Hello, I'm Dr. Amy. This is my assistant Miles, who will play an injured child today. In the emergency department, I do a lot of small traumas, and I often get asked how to fix them at home. So today, we're going to discuss something called a nursemaid's elbow. These usually happen to children between the ages of about 2 and 4, when the children want to go in one direction and the parents want them to go in another. The parents pull them to come with them, but a pull and a twist at the same time can pop the elbow out of joint. Except for it's not really popping the elbow out of joint. What it is there's a small ligament that goes over the radius bone, and this ligament pops outside the edge of the bone, which causes extreme pain and causes the child not to be able to hold their arm, not to be able to use their arm well. So when they come to the emergency room, often the children are holding their arms into their side about this angle. And this angle and the fact that it hurts at the elbow, but that there wasn't a fall, and there wasn't a fall like this, that usually tips us off that this is a nursemaid's elbow. So if you're sure that your child had his elbow pulled before the pain started and then it wasn't a fall, here's what you can do to fix it. The ligament is here. So if you hold the child's arm and feel with your hand, feel that edge of the elbow that's on the outside that corresponds to where the thumb is. That's the radius. That's where the ligament is. Take it and it's called supinating the hand, which means you make the hand like it's holding a bowl of soup. Turn it this way and then squeeze the elbow close, and right about here you'll feel a little pop. And with the pop, so push right there, you'll feel a pop, and it hurts when you do the squeeze, but in about 5 minutes the child will start using their arm again. An alternate method of doing this is, again, hold so you can feel when the arm pops, but it's called hyperpronating, which means that you go flat and then even a little more flat than usual, and then the twist, right about that amount of twist, is where you're going to feel the pop. Some studies show that this works a little bit better. The most important thing is, if it doesn't fix in 1 or 2 times, then you do probably need to get an x-ray to see whether it could be broken, but you're not going to make the arm fall off. There's really not a lot of damage you can do if the elbow is twisted if you're not able to fix it yourself, because it's just a small ligament, and if you can pop it back yourself, you will not have to come see me. Thanks very much for this little bit of medical buzz. Call or email with questions. Thanks. Bye.